imperfect descent of the testes, also referred to as cryptorchidism, is a condition in which one or both testes fail to descend into the scrotum during fetal development or shortly after birth. Normally, the testes form in the abdomen and gradually descend into the scrotum through the inguinal canal by the time of birth. When this process is disrupted, it can result in an abnormal position of the testes. Types of imperfect descent. 1. Undescended testis, cryptorchidism. The testis remains in the abdominal cavity, inguinal canal, or just outside the scrotum. It is the most common form of imperfect descent. Classified into intra-abdominal, testes are located within the abdominal cavity. Inguinal, testes are trapped in the inguinal canal. Prescrotal, testes are just above the scrotum. 2. Ectopic testis. The testis descends but moves to an abnormal location outside its normal pathway, such as superficial inguinal pouch, perineum, femoral region, base of the penis. 3. Retractile testis. The testis moves back and forth between the scrotum and groin due to an overactive cremasteric reflex. It is not a true form of cryptorchidism, as the testis eventually resides in the scrotum. 4. Ascending testis, acquired undescended testis. The testis, previously descended into the scrotum, moves back into an undescended position due to a shortening of the spermatic cord or other factors. Causes. 1. Hormonal factors. Insufficient production of androgens, testosterone, or other hormones like anti-Müllerian hormone, AMH. Impaired hypothalamic pituitary gonadal axis. 2. Mechanical factors. Abnormalities in the gubernaculum testis, a structure guiding testicular descent. Narrow or obstructed inguinal canal. 3. Genetic factors. Mutations in genes like INS3 or LGR8, which are involved in testicular descent. Associated syndromes such as Klinefelter syndrome and Prader-Willi syndrome. 4. Environmental factors. Exposure to endocrine-disrupting chemicals during pregnancy. Prematurity and low birth weight. Complications. 1. Infertility. Elevated temperature in the undescended position can impair spermatogenesis. 2. Testicular cancer. Significantly increased risk, especially in intra-abdominal testes. 3. Hernia, associated with a patent processus vaginalis. 4. Testicular torsion. Increased likelihood of twisting, leading to compromised blood supply. 5. Psychological impact. Cosmetic concerns or social stigmas may affect self-esteem. Diagnosis. 1. Physical examination. Palpation of the scrotum, inguinal canal, and surrounding areas. Observation of the cremasteric reflex. 2. Imaging studies. Ultrasound to locate non-palpable testes. MRI if ultrasound is inconclusive. Laparoscopy, both diagnostic and therapeutic. 3. Hormonal tests. Measurement of luteinizing hormone, LH, follicle-stimulating hormone, FSH, and testosterone levels. Treatment. 1. Hormonal therapy. Administration of human chorionic gonadotropin, HCG, or gonadotropin-releasing hormone, GnRH analogs may stimulate descent, but success rates are limited. 2. Surgical intervention. Orchiopexy. Surgical procedure to reposition the testis into the scrotum, typically performed between 6 months to 1 year of age. Orchiectomy. Removal of the testis if it is non-functional or cancerous. 3. Follow-up care. Regular monitoring of fertility and cancer risk. Psychological counseling if needed. Prognosis. Early detection and treatment, preferably before the age of 1, significantly improve outcomes in terms of fertility and cancer prevention. Delayed treatment increases the risk of complications.